So this would be the full package that we put on somebody who is cognitively impaired, has a high fall risk score, that we're worried about falling. So this bed in particular is not the lowest bed that we have. We have other beds that we would put in place that would go down to the ground about 6 inches from the ground itself. In the event that there was still a fall, they would fall into a pad, and so it would reduce injury. In the meantime, to prevent that fall, we have the blue bed pad that we can slide underneath the sheets, and it is very sensitive to any pressure changes. So it would alarm loudly if the patient were to try to sit up or shimmy or scoot off the edge. The green bed alarm has a clip to it, which clips to the patient's shirt. If they sit up or move, it'll disconnect the string from the box, which will also alarm loudly. So there's 2 alarms in place. We do have quite a few smart beds. This is an ICU, so these are ICU beds, but they do have built-in bed alarms, which allows you to change the patient's positioning. So you can alarm if they sit up, or you can allow them to sit up, but if they try to shift to the edge, it will alarm saying that they are trying to shift out. So that would be a full bundle. The other patients who may not be necessarily cognitively impaired, but have medications on board that we're worried about them potentially forgetting that they need to call the nurse, we could put bits and pieces of the package together on that patient, depending on the nurse discretion and assessment of that patient daily. The other piece that we have in the rooms are these whiteboards, which are helpful to the patient and to visitors whenever they come back. And it just describes the date, the location, contact information for the floor, physician, nurse for the moment, diet, what the plan of care is today. For example, this person would have a CT of the abdomen, just so they can understand what they're expecting for the day. And then what's important to them, so their personal goals, so that everyone's on the same page to help them achieve that. This is our comfort round clock. So when we do our comfort rounds, we're letting the patient know we will come back within usually a 1 to 2 hour window, approximately this time, so they can anticipate our return. And then mobility is important for anybody coming in to assist. So if I came in and it wasn't my patient, I would at least know immediately how I could mobilize this patient if they needed assistance. And then any additional notes. Staff are coming together, it's very quick, it's about 3 minutes or so, and they're all together as a group discussing who are their high fall risk patients in their areas, any particulars about those patients that might not be specific to everybody. For example, this one's very fast. If you hear, you have to get there immediately, so you don't have much time, right? Or this gentleman, if we do a couple walks around the unit, that has happened before, he seems to settle, he feels comfortable, you know, just mobilizing, engaging socially, things like that. So little tips and tricks for those particular patients. And then everyone on the unit is aware of who the fall risk patients are, so they're all equally engaged in preventing falls for all the patients.